For panel, for panel 2, I really appreciated hearing the words from SAMHSA about different work that's taking place at the federal level to support more cross-sector collaboration, prevention-prepared communities, and then examples of initiatives like Project Launch that have a really strong focus on very, very early childhood development, which I know everybody in this room certainly embraces as a very wise investment. And it was also extremely thought-provoking to hear from those individuals who are working with intermediary organizations and support centers within different states, in Colorado, in Pennsylvania, and in New York, who are fulfilling a really key function of acting as a bridge between the research base on one hand and then the actual real world on the ground circumstances of those communities that are striving to implement evidence-based interventions. And as I was hearing the 3 individuals working within the states talking, it occurred to me that this is something we really need to pay more attention to. When we're encouraging scaling up, it can overwhelm the capacity of the individual program developers to be able to provide the level of training and technical assistance to the wide range of communities that are wanting to implement these practices. And the nice thing about these intermediary bodies is they can take that on and really get to know those local communities and challenges within the local communities. Who are the stakeholders within that community? What are the local political challenges? Do you have provider organizations that are maybe working on a shoestring budget, and that's some of the reality within their circumstances? And then on a broader level, the juggling act that takes place of the demands on one hand with program developers who want to make sure that you adhere to the fidelity to the evidence base, local, state, or federal funders who might have their own sets of requirements, and then again, the local pressures and the local reality of the day-to-day functioning under which these agencies and these providers operate. And so it made me find myself wishing that I had a cloning machine to enable more states to have access to these types of intermediary support organizations. And I think that one of the things that is a key takeaway for policymakers and funders is the importance not only of investing in programs and providing funding for programs, but also investing in the process of implementation. Okay, that we really need to pay attention to that piece of what implementation science tells us, that, you know, it's not just pulling a box off the shelf and ta-da, there you have this program, but there really is a full process with partnership development and workforce development and organizational capacity building that you really do need to pay attention to. And so I saw that as a key takeaway of the importance of supporting not just the programs, but this full comprehensive, thoughtful process of implementation. And I think that that's a challenge for us as a field to incorporate that within the regulations that we set up, within the funding that we put forth. Brian had, towards the end of his talk, had paraphrased somebody from Annie Casey making the observation that a bad system is going to win out over a good program every single time. And so I think that it's a nice takeaway for us to try to create good systems that can be supportive and can help to provide fertile ground for enabling these programs to reach the maximum intended results that we know that they can have. Thanks.